Thank you so much for joining us. This is our first webinar with Therap, so we can introduce them to all of our home health care service providers. I am Kelly Clace, Technical Project Specialist with the Division of Long-Term Services and Supports here at the Department for Medicaid Services. Some of you may be familiar with me from the waiver side. If not, we'll probably get to know each other pretty well over these next few months. So a few housekeeping things before we get started. If you're having any kind of trouble hearing, which I realize you probably can't hear me now, but if you know anyone on your team is trying to get in, they're having trouble hearing, there is a dial-in number and conference code there on your screen. I will put it in the chat as well, or maybe we're dipping in and out, anything like that. You can at any point go ahead and dial in. You keep the webinar up on your screen, but then listen through your phone if you need to. If you're having any kind of connectivity issues, Chrome or Edge is your best browser. So if you're using anything else, you might want to try to log out, log back in. And if you need help at any point, you can go ahead and hit that chat icon. One quick note about the chat icon, that's also where you're going to submit any questions that you have. You may on your screen have a Q&A box. If you do, please do not use it for questions. Long story, can't see it on our end. So if you want to get your questions right to us, go ahead and just put them in that chat box too. One last note from a couple of the other webinars that we've done this week in Teams. A few folks have said they had trouble seeing. If you're having trouble seeing the presentation, you can't find it, there's a little button at the top that says view, and then it gives you an option to focus on the content. So if you select that, that should help as well. So with that, I'm going to throw it over to Jason Laws with Therap. Oh, I'm sorry, April, our Assistant Director in the Division of Long-Term Services and Supports, to kick us off before we hand it over to Therap.
All right. Thank you, Kelly. We appreciate you all joining us, Medicaid and Therap, today for our town hall on electronic visit verification for home health care services. We will be partnering with Therap, and we're very excited to move forward and get our providers onboarded and trained in using our new EVV solution for HHCS that go live. We will discuss it further in the presentation when I turn it over to Therap, but our go live, it will be January 1 of 2024. And at this time, I will turn it over to Jason Laws. Thank you.
All right. Thank you so much, April and Kelly. And thank you to all of you for taking a little time out of your Friday to join us to learn a little bit about what we're going to be doing here in the great state of Kentucky. As April said, my name is Jason Laws. I am Therap's Director of Quality and Data Initiatives. But frankly, what's more important for you to know about me now is that I am one of the project leads for the EVV implementation here in Kentucky. As you can see on your screen right now, I've been with Therap for some time and worn a few hats along the way. But a great deal of the experience I've had with Therap has been working really across the country, but particularly here in the Southeast, as well as right there in the state of Kentucky, and onboarding Therap for a lot of our providers and working with states and all of those kinds of things. So for all of those reasons, I'm very excited to be working with you guys on the EVV implementation. We're going to be going over a lot of information today, kind of about our EVV platform and about the onboarding process, making sure you guys know exactly what to expect in the coming days and weeks and months. But before we jump into that, I would like to hand it over to our COO, Mr. Justin Brocky, to give us a warm welcome and get things started. Justin?
Thanks, Jason. And again, I want to sort of second what's been said already. We're very, very honored and excited to get this opportunity to work with the state of Kentucky and to you guys as providers. And really, you folks are what we're all about as a company. It's about the services that you provide and being there to support you doing that at the point of service provision, which is really what the EVV is all about. You know, it's about having a system that works with you and works for your staff while they're providing services. And you being here is the first step in that. It really is. There's going to be an awful lot of engagement over the next few months as we hit that January 1st deadline. And we want you to be in touch with us. This is the more you talk with us and with our partners at the state, the easier this is going to be for everybody as we go through. This will be your first introduction, but you'll get to know those of us who are on the call today and many, many more therapists Therap team members over the coming weeks and months. Please, again, you'll hear this a lot. Don't hesitate to get in touch, and you can start by asking us questions in the chat, and looking forward to getting to know you all better.
All right. Thank you so much, Justin. So with that, let's go ahead and get started. As you guys can see, we've got a lot of stuff we want to get through in the next hour and a half. But it probably is important as anything else. We want to make sure that we're addressing and answering your questions. So we want to give you guys a solid overview of exactly what it is we do and what to expect, but certainly with every anticipation that we're going to be given some time at the end for a lot of Q&A with the attendees that are out there. So basically, kind of here's the rundown of what we want to do. First things first, we want to introduce you guys a little bit to Therap. Obviously, we are the EVV solution for the state of Kentucky now. We're very excited to show you EVV. That's where the focus of the conversation is going to be. But I'm going to take just a second at the beginning to kind of introduce you to who we are as an organization. Then we're going to run into the overview of our EVV platform itself, as well as a quick touch on Therap's billing solution. We do have the state of Kentucky has been gracious enough to make available to you guys the option for you to not only utilize the Therap EVV platform, but to also use our billing solution to be able to direct claim for the services being provided directly to your MMIS and MCO. So we're going to talk a little about that and give you guys a sense of how that piece works should you choose to take advantage of it. We're then going to jump into an overview of the project itself. Specifically some of the timelines that we're going to be hitting as we go over the coming weeks and months, and then get really specific in terms of the next steps, depending on what type of agency you are, whether or not you're planning on using Therap's EVV or a third-party platform, that kind of thing, exactly what you can expect starting as soon as we finish off our call today in terms of the onboarding process, the training process, the go live, and kind of all of those things in between. And then, as I said before, we're going to take a little time for Q&A at the end. So with that, like I said, I want to introduce you a little bit to Therap. Obviously, you've met me now, you've met Justin, but there's a lot more, obviously, than just the two of us when it comes to Therap. We have an extremely comprehensive team with a wealth of experience across human services, as well as specifically with EVV. As you can see here, we have our leadership team represented by Justin, myself, with the project team, along with Beverly and Jennifer. We have our technical team, several of whom are actually on this call right now. These are the folks that actually make sure this stuff works under the hood. And then really the backbone of Therap and the folks that you guys are going to see on a regular basis, that's our support team that are going to be working hand in hand with you to get your accounts up and running. Most notably, you'll see Mr. Nick Anderson and Ms. Kelly Galloway are going to be doing some demonstrations of this system, and they're going to be providing a lot of the ongoing training that you experience. Beyond just what you see on the screen, though, we've got a ton of other folks that are going to be chipping in to support this. It's obviously a huge priority for Therap, and so we look forward to dedicating any and all resources to you guys. So you're going to see a lot of us over the next few months to make sure that this is successful and that you guys get to where you need to be with utilization of EVV. So that kind of brings us to the question of exactly what is Therap. Well, in case you were wondering, we are not some guys that just a couple of years ago decided, hey, we should build an EVV system. We've actually been in the human services game for quite some time, about 20 years now, providing electronic systems for service providers. We are a software as a service, commercial off-the-shelf based system that really focuses on the information sharing and documentation and everything that goes into quality services. As you can see in the right balloon over here, we really work with all aspects of human services. We all came from human services, so we have direct practice experience as well as working on the software side to really integrate between states, counties, managed care organizations, providers, and all the way to engaging directly with individuals and families to make sure that we're properly sharing information and doing everything that we can do to give you guys an integrated, efficient solution that helps you provide quality services. And that's really where we come from. And the experience that we gained in doing that kind of thing for such a long time is what's contributed directly to what we believe is a fantastic EVV solution that we're extremely excited to be sharing with you guys, certainly today and ongoing in the weeks and months ahead. So where we want to go now is to talk specifically about that EVV solution. I want to talk about it at a high level in terms of what it is, where it comes from, and how it works. And then I'm going to hand you over to some of our experts in the application itself. We're going to provide a demonstration of exactly how this thing works on the ground so that you can see that functionality, as well as the associated billing piece that goes along with it. But before we do all of that, I got to make sure that everybody knows exactly what it is that we're here to talk about, and that is specifically electronic visit verification, or EVV. My assumption is that the overwhelming majority of you by this point has at least a general familiarity with what EVV is. You may have already been providing EVV services for a while. Others of you have probably heard about it, so you kind of know the gist of it. But there may be some of you guys that know, hey, this is just something I know I've been told I've got to do. I better get on that call on Friday and figure out a little bit more about it. So I want to at least level set here so that folks know exactly what it is we're talking about. So in a nutshell, what EVV is a tool for capturing point of service information for certain home and community-based services. Specifically as part of this contract for you guys, it's going to be home health. We're going to be working with your personal care services next year. But it's not, again, not just something that Kentucky decided all of a sudden, hey, we need to make our providers do this. It's much more of a federal initiative that's been underway for quite some time underneath what we refer to as the 21st Century Cures Act. This is a really big piece of legislation with a whole lot of stuff in it that we're not going to talk about today, but specifically in terms of how it impacts what we are doing, is that this is a federal requirement to verify certain things under personal care services and home health, and it's designed overall to improve quality assurance. And so as part of that is the mandate that states require their service providers in personal care and home health be able to provide these electronic visit verification services. So what exactly goes into that EVV? I went the wrong way. Excuse me. There we go. So what exactly goes into EVV? You guys are saying, I've been documenting the service I've been providing for a long time. How is this any different? Well, what really separates EVV is the mandate that 6 elements of service delivery and tracking are tracked for all of the services being provided. We've got to really know each one of these things and capture them in order to provide true electronic visit verification. Obviously, the type of service being performed. Some of you guys may provide multiple service lines. We've got to know exactly what service is being delivered. Obviously, we've got to know the particular individual to whom the service is being delivered, the date of the service delivery, and then really the piece that I truly think kind of embodies when folks think about EVV, what they largely think about is this location piece. This is what separates it maybe from a lot of the service documentation that perhaps we've done over the years and decades up to this point. We've always tracked services, but this location piece, the geolocation that's occurring through GPS, through mobile devices, is what is kind of the foundation of how EVV is designed to guarantee that folks are essentially providing the services they say they're providing in the location with the individual that they say they're working with. One of the underlying reasons for the Cures Act, for the EVV mandate, is the overall reduction in fraud and improvement in overall quality services and quality assurance, and capturing that location piece is a crucial aspect of that. Beyond that, we obviously also need to be able to capture in real time the staff that is providing the service and the time that service begins and ends. And so as you're going to see as we go through our functionality, all of those elements are captured right there at that point of service between a caregiver and an individual service recipient. Now, having said all of that, you guys do have a couple of options in terms of how you choose to do this. And certainly, let me be the first to officially commend the state of Kentucky for what we believe is absolutely the correct approach to electronic visit verification. And what that means is they are working with us to offer you guys a full, comprehensive electronic visit verification system, but they're not mandating that you necessarily use our platform if you already have a platform in place that you would like to use. That's what's referred to as an open model. So these are the two options that you guys have in front of you. And obviously, we'll be talking a lot more about these going forward. But the general gist is you have the option of utilizing the state EVV system, which is Therap's EVV, what we're going to be demonstrating for you today, to capture that point of service documentation. That data will then flow over to what we refer to as the Therap aggregator. Kind of the way to think about the difference between our EVV platform and our aggregator is that the EVV is the point of service data collection. The aggregator is the repository where that data gets sent, so that you can either choose to utilize Therap's EVV platform and send it to the aggregator, or you can use a third-party EVV system of your choice. Obviously, should you choose to do that, the cost associated with that third-party vendor would be up to you, rather than Therap, which is provided to you at no cost from the state. But should you choose to use third-party, that data will flow to the same Therap aggregator, so that we can aggregate all of that EVV data together, whether it be from Therap or from an alternative vendor. It's all coming together to be able to do reporting, quality assurance on the data that's coming in. Hopefully all of that makes sense. Certainly we'll be talking a lot more about it, but wanted to make sure you guys were aware of the options that you had available to you. I do want to briefly mention down here, just as because there's certainly potential for some confusion here, that you do also have the option to utilize Therap as a third-party system. And well, what does that mean? You just said that Therap, the state system, how could it also be third-party? Well, basically what it means is this. You can either use it under the state contract, where it's connected to, as I said, the state contract, and the data flows. You use Therap EVV, it flows to the aggregator. If you already have a Therap system and perhaps are interested in using functionality beyond just EVV, that is an option available to you, obviously at your own expense. But should you choose to do that, you can still send EVV data to the aggregator, just as you could through the use of any other third-party system. So that's an option. If that's something that you guys want to explore, certainly we'll be happy to discuss that with you as well. But any and all of you have these two options available to you. Regardless of the option that you choose to utilize, really everything within this is tied together under a concept that we refer to as secure transparency. And so what exactly does that mean? Obviously, we understand the importance of security, protection of data, of HIPAA, and all of the technical and logical controls and role-based controls that go into making sure only the right folks are seeing data. That being said, we also believe in the importance of transparency through the fact that folks with the appropriate roles that are involved with service delivery, whether it be at point of service, whether it be in administration of services, whether it be in billing, whether it be going in and claims adjustments, all of that kind of stuff, we believe all folks need to be able to securely access the same information through the same integrated systems. And that's essentially kind of how we tie all of this together. That's where the role of the aggregator really takes effect. So if regardless if you're using Therap or you're using another vendor, all that data is coming together so that we can provide that level of quality assurance to make sure that the folks you're supporting are getting the best services available, and we're getting the data that we need to ensure that. So having said that, what I want to do now is kind of, as I said, give you a high-level overview of how of the workflow within Therap EVV and talk a little about that. I'm also going to talk a little about how the aggregator piece works with a third-party vendor, but then I'm going to hand you over to the real experts within Therap to walk through it within the application. But generally speaking, our EVV workflow is represented largely by the graphic on the screen. As you're able to see here, you're able to go in and create scheduled slots that are designed to capture all of the information that you provided. You also, should you choose to do so, have the ability to set up what we call self-check-in, so that a staff member would be able to check in to a service without a pre-scheduled slot. But either way, when they're performing that staff check-in and out, it's creating and capturing all of the data elements that I mentioned before to provide true EVV. Now, from that point, you can do a lot with that information. Schedulers are able to get in there and see the data. Should they have access set up for them, families are able to get in there and access that data. We're able to do scheduling reports. We're able to do a lot of different kinds of reports. And should you choose to, again, I want to make sure folks understand this is optional, but should you choose to, you can also utilize that data to perform claim submission through to your MMIS or your MCOs and the payers that you guys are working with. So it's designed to kind of be a one-stop shop of capturing all that data to meet really all of those different masters, right? We've got to get paid. We've got to submit the EVV data. We've got to be able to do QA reporting, and all of that information captured at point of check-in and out is going to be available to you to do that. Once the data is collected, we move over to this fun diagram that I certainly hope it doesn't provide utter confusion to everyone. I don't expect anybody who has not seen this before to walk off of this call today and understand every single component of it. But I do want to make sure that you guys at least understand what's happening at a high level. So that's why we thought it was important to at least give you a look at what basically what this diagram represents. We're all starting right up here at the top, where we're capturing our EVV service data. Now, this may be captured through Therap, which is what we expect most of you guys will do, but we also understand several of you may have third-party vendors that you're working with where you're intending to capture that EVV data here. That's perfectly fine. This top piece we're all going to be doing, whether it's Therap EVV or another vendor. But once that data is collected, it's important to know where it's going and what it's doing. So regardless of which vendor you're working with, that EVV data is then going to flow over to the Therap aggregator. As you recall before, that's kind of the repository for all of it. So we're going to, if obviously with Therap, it's a seamless transition over to our aggregator. If you're using a third-party vendor, we're going to work with you to certify that and make sure that data exchange can work properly so that your third-party vendor is sending that data over here. And then on the other side of things, you guys have to get paid. So that EVV data also has to go over to your MMIS and MCOs in the form of claims data. Now, again, if you choose to utilize Therap, you have that available to you to do direct claiming. If you're using a third-party vendor, then you're going to need to be able to do your claiming that way as well. But what you end up with is the claims data going to the MMIS and MCOs, the EVV data going over to the Therap aggregator, and then we provide basically kind of the validation. We use a bunch of files and data information exchanges between these systems to validate that billing, to make sure that what folks are getting paid for are the actual services being provided. So that's kind of at the core of how EVV provides you with that overall quality assurance and really fraud protection in terms of our billing. So again, I know this is a lot, it's a somewhat complicated graph, but I really did think it was important for you guys to kind of understand where the pieces are. And certainly as we continue to move down the line, we'll talk with you a lot more about how all of these things fit together, and are happy to answer additional questions later in the presentation. But regardless of which approach you use, whether it's the third-party vendor or the Therap EVV platform, as we said, all of that data is going to go to the aggregator, and you all are going to be able to access directly that aggregator. So even if you're not using Therap's EVV platform, we will work with you to provide you login access to the aggregator so that you can go in there and make sure that your visit data is flowing over. So again, that's going to be a piece that we provide you in terms of training and setting up that access. So wanted to make sure that folks understood that regardless of whether you use our EVV platform, you will be able to see the data in the aggregator. So that's a pretty high level overview of how this process works. And so what I'm going to do now is actually stop sharing my screen and hand you guys over to our resident EVV expert, Mr. Nick Anderson, who is going to show you what a lot of this process looks like within the Therap application. So Nick, the floor is yours.
Thank you, Jason. All right. So hopefully everyone is able to see my screen. My name is Nick Anderson. I am a training and implementation specialist. You're probably going to get used to seeing my face. All right. I do a lot of EVV implementations. All right. And I'm really excited to be working with you all in Kentucky. So I am going to take you through kind of all those high-level overviews, show you some of the processes here. There is going to be a lot of information, all right? So don't panic, okay? You're going to see this. You're going to get a lot of repetition. You're going to meet with us, and we'll be able to answer any questions that you have, okay? Also, as providers, I know that you wear kind of multiple hats, and to guide you through this demonstration, all right, I'm just going to try and highlight maybe some of the people who might be needing to know these steps or who would be doing these steps, okay? So over on my screen here, and sorry, I'll be kind of looking over that way. We are in a demo account, all right? There's no real individuals, no PHI, any of that stuff. So as a provider, you might want to schedule your staff, all right? So within Therap, you're able to essentially create schedules for people. You're also able to do that reporting, kind of maintaining all of that if you need to. So I'll just show you how to do a schedule really quick. And there's a couple of ways to do this. There's just this new slot option. What I want to do, though, is I want to show you kind of how this grid looks, okay? So I'm going to do this create edit, and it'll have you select your program and the individuals that you are going to work with. I'm just going to go ahead and pick one person to keep it kind of simple here, all right? So I'm going to work with Olivia Campbell today. These are all the staff that I could schedule with her, so I'm going to skip. And this is going to show me, all right, this is our scheduling grid, all right. It's going to take you to today's date. And you'll notice that there is a legend up here in the in the upper left corner, all right? So anything that's green is completed, which means that there's a staff that's already checked in and checked out for that particular service, all right? If you're wanting to do scheduling, you'll notice that there's these kind of blue slots, and that is an approved schedule that's been created. It hasn't been completed yet because we're not quite at 3 to 4, which is when this slot is scheduled for. You can get a couple of different views. My personal favorite is this month view, all right? And as you can see, it really kind of opens that up. So you as an administrator, if you're wanting to look at a schedule, looking at a calendar view is a really great way to do that, all right? If you know someone is getting services every Tuesday, Thursday, or maybe Monday, Wednesday, Friday, you're able to kind of view all that at once. As your staff start doing check-in and checkouts, you can also use this for like QA, visit maintenance, reporting, all right? So I can see that there's a couple of these bright yellow, these bright yellow slots, and that just means that someone had checked in, but maybe the staff had forgot to check out, all right? And I mean, if your staff do everything perfect 100% of the time, right, you won't have to worry too much about that, right? But for, I would say, the overwhelming majority of everyone else, a large part of what EVV will be is, again, doing the reporting, checking to make sure that everything is being done correctly. I can also see, like on the 26th here, that there was a scheduled slot that's still scheduled. Since we've already passed the 26th, I might need to, again, as an administrator or someone who's working with scheduling, need to go in there and make an adjustment on there, right? Maybe the shift wasn't worked and I need to delete it. Maybe it was worked and the person wasn't able to check in or check out for whatever reason. And you can do manual data entry if needed. There is going to be an exception code that's required to kind of explain why it wasn't captured in real time. What I'm going to do, I'm going to go ahead and just schedule a slot for Olivia for the 30th. Okay, so I'm just going to double click on the 30th, and it's going to take me to what it looked like very similarly when we first got on here. And I'm just going to schedule an hour slot here from noon to 1. So I can double click at 12 p.m. and it has already put in that noon to 1 slot. If I needed to change this or edit this, like let's say I maybe want to make this 1:45, I can just go in and with a couple of clicks, switch that to whatever I need it to be. If you think about what Jason was saying earlier today, about those 6 data elements that are required for EVV, this is where some of those charts are going to start making sense. All right. So on here, we need to get those 6 data elements. So we have our date and our time right up here. We're going to pick the individual that's receiving services, who's Olivia. So we have those 3. We're going to select a program, and that's going to allow us to select a service. So I'm going to take that private duty nursing. And again, that service was kind of that fourth one. And then I'm going to go ahead and assign whatever staff I need to. And I'm going to put Sawyer in here. There is the ability to put in the location, all right? But when your staff do that check-in and check-out, we'll be collecting their actual location, right? Using a couple of methods. I'll show you how that self-check-in looks, but essentially we're going to be getting the latitude, the longitude, and recording the actual time and date that it's checked in for. So I'm going to leave the rest of this blank because we'll collect it when we do that check-in. All I need to do is go down and hit approve. And I have a brand new approved slot for my staff, or for me, because I'll be working this one, for tomorrow. All right. We also have, if you're interested in doing scheduling, I mean, there is kind of, whenever I talk about EVV, I'm a huge fan of self check-in, which I will be showing you here in just a little bit. All right. But if you are wanting to create schedules, there is this platform to do it. We also have the ability to, once a schedule is in, do like a bulk copy feature. All right. So if you're thinking about, hey, you know, I have like 30 people that have EVV services, they all have separate things. I'm going to have to schedule every single day for them. You don't have to do that. All right. There's a bunch of flexibility when it comes to our scheduling and EVV module. You can schedule some people, you can have other people do self check-in. You can really mix and match and find what works out best for you all, okay? So that's just a little bit of the scheduling. And like I said, very high level overview today. So if you didn't catch all of that, don't worry. I can promise you this is not the last time you're going to see this grid, okay? We'll definitely be doing a lot with it. So I'm going to go ahead and switch real fast, all right? From this, from the web version, all right? And we're going to kind of switch our hat, all right, and go to what like a DSP or maybe a nurse or a therapist would do, right? Because they're the ones who are going to be providing some of these services. So I'm going to go ahead and stop sharing my screen. And then I'm going to share my mobile real quick. Ooh, and I don't know that I have the ability to do that. If there's someone that would be able to promote me so I could do that, I would appreciate it. I'm gonna just go back here and I'll show you a couple of other things while I'm waiting for that permission. So I apologize. Like I said, in here, there is kind of a variety of things that you are going to be able to do. All right. And one of those is going to be reporting. Okay. Reporting is something that's actually, again, you're going to spend quite a bit of time doing that. You want to make sure that all of your visits are going to be matching up, particularly when they go to the aggregator. All right. All right. So I'm going to go ahead and just do a quick share here. All right. Oh, yep. And so I can see a couple of questions here. All right. So aides use a cell phone. Will they be able to check in and check out with their phones? They absolutely will be able to do that. I'm going to see if I can get someone to give me permission to share.
You should be able to do that now, Nick.
Okay. All right. Excellent. Thank you.
I was gonna say, yeah, you should have all the permission you need there.
Okay. All right. Sorry. I had to join twice, so I really apologize for that. All right. So we'll stop sharing on the desktop and we're going to just share my phone screen. All right. And I'll try to hold it up so you don't have to see me looking down. So again, for the question about if your staff can use their cell phone, they absolutely can. I'm going to show you our mobile app. Okay. And again, each of your staff are essentially, so again, we got our staff hat on, right? Someone who's going to be providing these services. They'll have their own login name and a password. I'm going to go ahead and just log in using a biometric authentication. They can use a login name and password. And this is how your staff are going to be able to do this check-in process, okay? They can go to that scheduling EVV section. And I'm just going to hide this. Perfect. So you can see essentially what I was showing you earlier on the web browser. All right. I have a check-in that was started and completed earlier, and then I have something that's scheduled for me at 4 o'clock today. If I want to go back and forth and take a look at previous days, I can. So if I hit that little arrow in the top right, I can see this is what I'd be working for tomorrow. And I have that 12 to 1:45 that we just had created. If I wanted to check in on the scheduled slot, I can actually just swipe and do a quick check-in. What I want to show you, though, is the self-check-in feature, because that's the thing that I really like seeing, all right? And it's the thing that I think makes the most amount of sense to me. So if you are not wanting to schedule for your staff, you can give them the ability to do a check-in. So I'm going to go down to the very bottom and I'm going to tap that self check-in. And again, just keep in mind those 6 data elements that Jason had talked about earlier. All right. So if you go, they're going to select the individual they're working with. So again, today I'm going to be picking on Olivia. I'm going to select that program, and then it's going to have me select what service I'm providing. Okay, so I'm going to be doing this private duty nursing. Once I've selected those three things, that individual, program, and service, I can hit next, and this is going to pull up my location. All right. I am not in the great state of Kentucky. I am actually in the middle of nowhere in South Dakota. All right. So, like I said, there's a couple of ways that we're gathering this data. This is the image that's there is provided by Google Maps, and we're also going to be collecting latitude and longitude. So I'm going to hit that top little checkbox, and we're going to go ahead and get signed in. You are going to notice, all right, that it has now just created a new slot for me. Okay, there is, if you think back to what I was showing you earlier on that grid and those color that color code essentially, all right. The blue one is scheduled. This kind of orange vertical line means that it's incomplete. And then that green one means that it's been completed. All right. So at this point, this is all your staff essentially have to do. All right. They've checked in. They do not need to leave the app up and running. They can go provide whatever service they need to provide. And then when they're done, they would just need to go back to the mobile app. They'll probably need to sign in again. They can go to that scheduling EVV. And then instead of doing the self check-in, because that's actually going to create another slot, right? They'll be able to check out. And so they can either tap anywhere on that middle slot, or again, if they want to get kind of fancy with it, they can swipe from the right to the left and do that checkout. We're going to get an attestation, so I'll agree. Again, it's going to pull my location, and I'll hit that checkbox. And so what I think really is helpful here is if I tap on that record, right, or that slot that I just created, all those 6 data elements are listed here, right? I'm logged in under my account, so my name is put on here, right? So Sawyer is who I'm working with in this account. Has checked in and checked out. We did it for Olivia Campbell. It was for private duty nursing services. And then what's so cool is you can see the date, the time, and the location for all of that. So again, that's how our EVV solution captures all 6 of those data elements. Any questions on the mobile app? And again, anything that I'm showing you here, you are probably going to see multiple times. All right. I don't expect you to look at that and just think like, oh yeah, we got all that. Okay. Like I said, very new to the process, want to do a very high overview and show you essentially what I believe is the best way for your staff to do a check-in and check-out. Like I said, that's doing that self check-in. It is available for both iOS and Android, so thank you for asking that. Yep, so I'm currently on an Android version of it, okay? So does the mobile app have to sync with the web, or does this happen automatically? So this actually happens automatically. The check-in and check-out that I've done, you as an administrator, you'd be able to log in and see that, okay? Excellent question. So again, keep them coming. The other thing that I want to show you real quickly is I am going to check in on this scheduled slot, even though it's way before 4 o'clock in my time, right? So again, if you schedule for your staff, you can have them do that check-in and check-out by doing that swipe, or they can tap and do a check-in. Since I am checking in before this schedule slot, I am going to get alerted. All right. So if I just tried to do a check-in, it is not going to let me because it's going to tell me I have to leave a comment. And the comment is just explaining why I am here so early. All right. So since I'm checking in 15 minutes before or after of that scheduled check-in time, I'll need to leave a comment before I'm able to. All right. So I'm just going to say, all right, so I'm going to put that in, hit that checkbox, and then you can see that I now have that vertical line. It's changed, and I've checked in for the slot, but I haven't checked out. So a couple of really good questions that we have here. The clinician must verify that their EHR time in, time out has to match exactly to the EVV check-in and check-out. Yes, and that's actually what's really nice about how all of this works. All right. we haven't talked about the aggregator piece or for billing yet, but what's really so cool about this solution and the reason that I get so excited about it, and just I'm not a billing specialist, right? But I do a lot of EVV. The great part about this is it has your check-in and your checkout time. Kelly might mention this a little bit later on, but it has all of your rounding rules in there. So like when you collect your data in TheraP, and if you use us for claiming, and if you do, like I said, when it does get sent to the aggregator, since all of them come from this one source, which is this check-in and checkout, all that should be matching up. All right. So, and if there's no cell phone or internet connection, that was another one. We have a multitude of check-in processes. This mobile application actually allows for an offline version. So you can create schedules, your staff can check in and check out. We are incredibly rural here, all right? So like there are plenty of places that I know I just don't, that I know I'm not gonna get service, so. Yep. So if I wanted to, I'll see if I can do it real fast. Okay. So real quick, I'm going to go ahead, go into my settings, and I'm going to turn on my offline EVV. Sorry. All right. So once I have that configured, what I'll be able to do is I can take this schedule slot, and instead of doing that right to left check-in, I can actually move it from left to right and add it to offline. So I can do all that while I have service. Then when I go back out to check in on the mobile app, you'll notice that beneath the login button, there's this switch to offline login. And I can put in my name, and I'm going to put in, that secret 1, 2, 3, 4, 5, 6 pin. And now I can see that I have something scheduled for tomorrow that I can check in and check out for if I need to. All right. And again, you don't get that nice, pretty Google map that you were seeing before. All right. But what does happen that's really cool is even if you're not in an area where you're receiving like cell service or internet connection, there is going to be that latitude and longitude, and that's collected through various like satellites and cell towers, again, even if you're not able to receive a signal. So again, this is an incredibly cool feature. Particularly, like I said, I think because I am in the middle of nowhere in South Dakota, so service is definitely a thing that comes up. So again, I can do that check in and check out. Once I've done that, you do need to upload it. All right. Since this is done in an offline fashion, when you go to, like when I go to log in right now, it is going to tell me, hey, you have offline slots. Do you want to upload them? So again, if you're doing offline, there's a couple of things that you can do. But again, I think it's a really cool feature that's offered that makes it really easy to get really good data for your EVV. All right. And then that'll be available for up to 30 minutes, actually. So I don't see any, I mean, there's definitely a lot of questions and conversation, which is awesome to see. If there's nothing on the mobile app, I think I'm actually going to stop and I'm going to hop back over, right? We're going to put on our provider hat again here. All right. And then I'll show you how you can do that visit maintenance, check out some reporting metrics, and then also show you that aggregator. All right. So bear with me for 2 seconds while I just stop sharing my screen. And we'll do the share. Perfect. All right, so again, provider hat back on, stuff that you'd be doing as far as like checking out those visits. If I go to this create edit again, I can just kind of look for Olivia, because again, I don't want to overwhelm you all. And again, as I go in here, I can see a couple of things, all right? And I should have just stayed on that screen, so I'm gonna do that. All right, so this is the one that I checked in and checked out for earlier. You can see that there's like another 1 minute slot, and that's the one that I did myself check-in for. And then there's this scheduled one. And you'll notice a few things. First of all, there's a red border around it, which really is like a visual indicator for you that if you scheduled something, the time isn't matching up, all right? If you think back to those 6 data elements, and again, I hate having to keep referencing them, but it really does make the most amount of sense here. You are scheduling this slot. However, the cool thing about EVV is you are recording when the service is actually taking place. So if you were to think about this slot as kind of like, again, a job, right? If you're supposed to be there from 9 to 5, you might have that coworker that's there at 8:50 every day. There might be 8:55. I'm a 9:03 sort of person because I can't ever seem to get anywhere on time. But down here at the bottom, this is the actual time that service was started, okay? And that's what's actually really so neat about this, in my opinion, all right? It just shows you and gives you an idea of absolutely everything. And this is that part of those data elements, right? That this was started at 10:40 as opposed to 4 o'clock or whatever, right? So again, when you're talking about visits going to the aggregator, what you're going to end up billing from, this is the data that you should be billing from because that's the time that someone had checked in or checked out. Again, if there's an error or something, you certainly have the ability to correct it and change it if you need to. Okay. So like I said, this is just kind of one person on here. We do have a couple of exciting, like my favorite way to do reporting here is this schedule EVV dashboard. It can show you up to like 14 days. And it makes things that are not obvious, like really kind of pop out at you. All right. And it seems like it's taken a second to load. So, and I don't want to go too far over on my time. So I'm actually going to just take a break from the scheduling EVV because I do want to show you all the aggregator. Okay. Oh, well, there we go. All right. So the schedule EVV dashboard that's loading up here is really great because it's interactive. If I wanted to look for things like service duration, if I can see that there's visits that are 0 to 15 minutes, I can open this up, I can see them, I can click on that, and I can edit them directly from here, okay? So like I said, you do have a lot of really good reporting options for you all as providers to be able to maintain those visits. Like I said, I am going to just cruise over to the aggregator, all right? So this is web-based. And so even if you are not using Therap for your EVV solution, this is going to be kind of the same thing that you will see, all right? I am in a slightly different version than you'll see, but once you get logged in, this is what it will show up for you, okay? So you'll be able to take a look at all of your EVV data in the aggregator, all right? And it moves over automatic, but there's kind of a caveat with that. You want to make sure that all of your slots have everything that they're going to need, all right? So in the provider account, you can do a search, you can make sure that everything's moving over. If there's things that need to be corrected, you can correct it in there and they'll just move over. If I do an EVV data search, and I can do a week up at a time, so I'm going to go ahead and submit. I can see that there was one that was done today, earlier, and I can just click on this plus sign. And this is going to tell me all the information about that visit. So I have that check-in time, the checkout time, start, end time, the location, all of that information. And then again, you get your unit information in there as well. There is also going to be like a specific ID that you can use to search for this particular visit. And then throughout, like as things continue to accrue, there is this roll-up report. All right. So as there are multiples, you can view all of those visits at once. And sorry, Jason, I see your hands up. Okay. So yeah, like I said, that in a nutshell, all right, is kind of the whole EVV overview, all right? So again, your staff are mostly going to be doing, and again, mobile check-in, check-out, I think is the absolute best way to go, but we do have alternate solutions for that. That's essentially all I have to show right now. I mean, I could talk about this for hours, actually. All right, but I won't hold you all hostage doing that. So up next, I'm gonna let Kelly kind of take over. All right, and she's gonna show you a little bit more about that claims process if you're interested in doing that. Oh, and Kelly, I think we're muted. And I know that was the best intro you were ever going to give, too, is the worst part.
It was so good. Darn you. That's okay. Good morning. I know that Nick went through everything EVV, so now we're going to talk about personally my favorite part is going to be the billing piece of it. So let me go ahead and share my screen. And then if you can just, I just want to make sure you guys can see everything.
Yep.
Okay, perfect. So for you guys, with EVV, you're already going to, I'm just going to do a very high level overview of the billing. You will have to have service authorizations, and that's something we will walk through together. So where I want to actually pick up today is how you're actually going to generate your billing data and create your claim. So you can see, again, I'm using a demo account. I have both professional claims and institutional claims. You probably won't have that. That will depend on your services and how you submit those claims now. So for today's example, we're going to do the professional claims. So the first step you're going to do is you're going to come here to this billing conversion, and you're going to do EVV billing conversion. So what this step does is it gives you the ability to select your service code that you want to generate for. So today I'm going to do some private duty nursing because I know that Nick had worked with Olivia, and this was the service code she was billed under. And then you're going to select your service dates. For today, I'm going to do the whole month of September. You can do a week at a time. You can do this every day if you wanted. There is a month limit on that, and you cannot cross months, but you can do up to 1 month at a time in this billing conversion. So here, when I click to convert the data, it's pulling up Angie, Ashley, and Olivia. So what this means is all of these have service authorizations that respond to this service code. So I'm going to go ahead and select all, generate that billing data. Okay, so we can see here we successfully were able to generate some data for Angie and Ashley. For Olivia, we have a couple red X's, which that's something that is expected for me of what? Again, this is a demo account. So we do have multiple people in this account. And for Olivia, I knew that we had billing data that had already been generated, but I did want to show you this today. You are able to generate your data. However, you cannot duplicate that billing data. So if you do that for September 15th, you had already generated for Olivia, but maybe you hadn't generated for Ashley. But you just selected all, the system is not going to double generate for Olivia for that date. So that is what that red X means, and you do get your system message that tells you exactly what's wrong. So ultimately, we want these checkbox, but sometimes we get those errors. So now I'm going to go back to the dashboard, and now I'm actually going to generate that claim. So what I'm going to do is go here to professional claim, new using template. Again, I will select that service code, and you can see here, there are lots of service codes. These are just what is in your account. So I'm going to select the private duty nursing. Again, I'm going to do my service dates. And then I'm going to click next. And it is going a little slow. This has that same with the service dates. You can do a month at a time, but you cannot cross month. So down here, you're going to see that we have Olivia, Sarah, and Miranda. These are individuals who have claim templates for this service. This does not mean that they have billing data that has been generated. So it doesn't mean you're creating a claim for them necessarily. If there is no billing data, no claim will generate. And then I'm going to click generate claims at the bottom. So as you can see, Olivia was the only one of those individuals that had any billing data, and that is why Olivia generated. And we can take a quick look at that claim. It is going to pull over all of your billing provider information, your individual's information, and as you scroll down, you can see the billing data. So I do want to open up this piece of billing data. I'm going to say yes because I'm not changing anything. I just want to show you guys that this data is pulled off of that service check-in. So you can see here, we had 2 units that generated, and then at the bottom, you are able to go back and see that EVV reference to show how you got those units. And so now that we have that claim, we can go back to our dashboard and send the claim. You have the option to do send or bulk send. The difference is simply the number of claims that you are able to send. I'm actually going to go back and do bulk send so we can select the payer. And then you again will select your service date, and it is going to pull up all of those claims that you have available. And that service code. Oh, okay. So this is the error that is telling me I didn't have any claims. So let's go back. So I am going to show you a service authorization very quickly. Again, we will do all of this together, but you do have to make sure, again, with a demo account, we have multiple payers. So there were multiple payers in here, and you can get all of that information off of your service authorization. So for Olivia, we can see she was using Aetna, not Medicaid. So I'm going to go back and again, do that bulk send, select my service code, and select my payer and my service date. And then click send. So this is going to send any claims that met that criteria. So if you had other individuals, again, besides Olivia, who met those search parameters, those claims would be sent as well. And that is the process of how you would generate your billing, generate your claim, and submit them. Now, I want to show you just a couple quick reports. First, I want to show you guys the utilization report. The utilization report, you can run this many different ways. I'm going to do it by date range and by service code. And again, I'm going to use the service dates of September 1st through the 29th. So what this report is showing you is it is showing you how you are utilizing your units. So if you wanted to look for Olivia and say, hey, her service authorization has 2,000 units for the year, but I want to see how many units I have utilized during a certain time frame. That's what this report is going to do. It will let you know if you are staying kind of on track with using her units as her authorization goes through so that you can capture as many units as possible. So this is a really good report. If you're expecting that I should have had maybe more than 8 units a month for Olivia, you know that you kind of need to work on getting staff scheduled to work with her more. Another report I just want to quickly show you is the reconciliation report. So the reconciliation report, again, you can run this by individual, you can run it by service code. I am going to use a date range and again use the same service dates of September 1st through the 29th. I'm going to select my payer. And then at the bottom, you'll see you have all of these output columns. For now, I'm going to click add all. You can pick and choose as you wish. And then I'm going to click search. So here we don't have anything to display because those claims have not completely processed yet. Let me back these things up. Okay, so the reconciliation report, what it will do is it is going to show you some claim information. Another great report that shows you information like that is going to be your billing summary report. So the billing summary report, I'm again going to use my service dates. And then you can select your columns at the bottom. Again, you can pick and choose or click add all. So when you are using the billing summary report, this is personally one of my favorite reports. You get a lot of information. You're going to get your service codes, you're going to get your individual, as well as you started scroll, I'm going to scroll down and scroll over. You can get your claim information. So you can see here the columns that I like to look for. You're getting your claim ID so that you know that you have created that claim and that claim status, so you can see that status of the claim. Right now, you'll see that there are some claims in the queued status. That means that I've sent the claim, but they have not picked up to go to the payer. In this demo account, they won't, but typically you will see your claims go to send. And it does break it down by visit. So you can see the number of units generated for that day. So that is just kind of a quick overview of the billing. Again, you do have the option to use this if you would like, and I would be happy to train anyone on that. And now I'm going to turn it back over to Jason.
All right. Thank you, Kelly. And thank you, Nick. I know that was a ton of information in a short amount of time. Appreciate you guys going through all of that and really talking about some of the options that folks have available to you. And again, thank you for all of the questions that we saw coming through. I know that's very helpful, certainly to get your questions answered, but every question you ask is probably a question somebody else wanted answered too. I think our team's done a pretty decent job of staying on top of those and getting you some responses back, but we're going to have some time at the end, and we'll keep an eye on that list to see if we miss anything and make sure that you guys get all of those questions answered. So thank you all again. And so I know with all of that information that you guys just got hit with, we certainly don't expect, as both Nick and Kelly said, and I said before, we don't expect that you guys are suddenly experts in this. That was not intended to be a training. Really, the idea was to give you a sense of the functionality available to you so that you knew what to expect, but we're going to be providing a lot of hand-holding and direct one-on-one training for that entire process going forward. And that really brings us to kind of where we are now and what we want to do for the remainder of our time together here this morning. And that's to talk specifically about the project itself and the upcoming steps so that you guys know exactly what to expect from us, to expect from HHCS and everything going forward. So again, a lot of this I know is review, but I think it's just good information to have again around the project is that we are the selected vendor for EVV for home health and personal care. And not only does it include provision of the EVV system that we've talked about, but also the provision of an aggregator for those of you that choose to use third party, assuming it is a certified system that meets CMS requirements, and we'll walk through that with your particular vendor. And we do have a plan to, or we are going to go live, I should say, on January the 1st, 2024. Also put this in here just in case there may be some of you guys that also provide personal care services. I know you guys are I think currently doing EVV for those folks with NetSmart, but the transition for that is planned for next year as well. We'll obviously keep getting you more information as we go through. And I've also included within the slides here your state site where these guys are doing a good job of keeping a lot of information available to you. You can link to this. We've actually got our support sites kind of linked up so that you can link from ours over to theirs, and we're going to be able to link from theirs back over to ours, but wanted to make sure that you guys knew this site was available to get updates as well. Go back to full screen. And so this is the particular timeline of what's coming, and then we'll talk about the specifics for each of the different categories of you guys that are out there. Obviously, we've spent quite a bit of the last few months working in preparation for this, getting things in place and doing all of our planning. And today's the big day with the kickoff town hall. So what happens next? As soon as we complete this, then we're going to move over to our provider onboarding phase, whereby we are working with each of you guys to get your organization set up with your Therap accounts, with your users and individuals and all the basics to have your accounts ready to collect EVV data. We're going to then be spending, obviously, a chunk of October and November getting everyone trained in a combination of different methods from, again, our one-on-one time with you. We're going to be using these town halls to provide training. We're going to give you asynchronous training materials, all the things that you guys are going to need to feel comfortable with utilizing Therap, and obviously we're always going to be available to jump in and help you out as well. We'll then be finalizing our testing with that go live date of January 1st. So how is all of that going to work? Exactly what can I expect? So I mentioned each of these, but I want you guys to think of kind of the upcoming steps in a series of buckets. Really, these 3 buckets are going to be the primary touch points that we all have with you. The town hall, the first of which is obviously the one we are on right now. We're going to continue to do these weekly. We're going to take next week off, but starting on October the 11th, which is a Wednesday, we're going to have another town hall, and we'll continue to do them weekly throughout the remainder of the fall up through the go live date. And they're really going to be focused on providing you the information you need to be successful. That's probably about as clean as I can make it. Early on, much of today, we're going to have a very standard agenda where we're having key items that we intend to go through and talk about based on what we know you need, that sort of thing. As we continue to move forward, though, it will become more and more attendee driven and Q&A driven. You know, as we get to know you guys better and you guys get to know us better as we go through this process, we're going to come to understand where a lot of the questions and things are. And so we're going to make sure that we're focusing our town halls on those questions that you guys have so that we're routinely addressing those. A lot of what we're going to be doing in the one-on-one with you guys, we will also repeat some of that in the town hall so that you'll have recordings of that so that you'll be able to see it. But that's really the focus there. The onboarding is going to be that time directly spent with you all within your organizations. As you heard us mention earlier, we've got a team of support specialists that are basically sitting at the ready as we speak to start reaching out to you guys and scheduling those one-on-one calls to get your account set up. And so it's really going to be focused on getting all of the underlying foundation of your account ready for that onboarding. And then we have the training itself, where we're basically showing you how to use it. We've got the users in the system, we got the individuals in the system, we got the services, we have all the stuff ready. Now we show you guys how to get in there and actually start collecting those visits, getting that data over to the aggregator, and making sure that we're tracking the services appropriately. And again, that training is going to be a combination of a lot of things, from live webinars to recorded webinars that we provide to you, to a lot of other asynchronous materials. We've been putting together quite a library of things that are going to be made available to you, not the least of which is a dedicated site that we have on our webpage that I'm going to show you here in just a few minutes, where you can access all of these different kinds of resources. So let's talk about how this thing gets started in terms of the provider onboarding process. How does that get initiated? Well, after this town hall, and I'll go ahead and tell you, we had originally thought we would probably send this out this afternoon, but we thought that it might get lost in your Friday afternoon stuff as folks are ending their week. So we decided it's going to go out the very first thing on Monday morning. So keep your eyes open in your emails on Monday morning for a link from our support team that is going to contain within it a JOT form, a couple of screenshots of which you can see on your screen right now. The first question that it's going to ask you is going to help us categorize what type of approach you plan on using for Therap. Are you already using Therap and you're just kind of adding this EVV piece to it? Are you not using Therap, but you plan to utilize our full EVV platform as well as sending the data over to the aggregator? Or are you not using Therap and frankly, you don't plan on using Therap's EVV? You're going to continue to use your own third-party vendor to send data to the aggregator. We're going to give you these questions, and based on how you categorize yourself there, you're going to get a follow-up series of questions asking for things about your agency, about the appropriate contacts that you have that are going to be involved with this process. If you're choosing to utilize third-party vendors, it's going to ask which vendor that you're working with, some contact information for those folks. And basically, we're going to be getting all the information that we need to get started with the onboarding process. So as soon as you submit that information and it comes back to us, you're then going to receive an automated invite that will allow you to go in and schedule your first call with us. It's going to provide the dates on there, just a series of, it's basically going to be a calendar where you can go select a date and the times that are available, and that's going to link you up with one of our specialists to schedule your first call to go through this. I will tell you the way that we've structured it is that calendar is going to let you start picking the dates on October the 11th. We're going to put a little gap in there to give us some time to get all of the kind of the under the hood work of the accounts created and that sort of stuff. But then we'll start getting those things scheduled with you and walking through it. Now, again, based off how you categorize yourself in those 4 categories is going to affect the approach that we take with you, obviously based on what you need. For those of you that are going to be using Therap's full EVV platform, there's going to be a series of 2 to 3 calls with our team. The first one is going to be focused, as you see on your screen here, on the basic setup of your account. How do we get in, set up our administrators to log in and do the basic configurations of our account? How do we set up our programs and sites? Essentially within our system, that's our services and the locations where those services are generally provided. We're going to show you how to set all that up. We're going to show you how to get the individuals that you're supporting into the system. We're going to do the same with how to get your users into the system and set up the privileging that allows them to do what they need to do when they're logging in. And that's going to be the crux of that first account, or excuse me, of that first call. At the conclusion of that, you're going to schedule your second call with that same support specialist. And then the second one is where we're really going to get into the EVV stuff, where we're going to do EVV specific configuration within your account and do all of the scheduling administration and show you how to do that setup. So that's going to be the breakdown of those first 2 calls that you guys have with us. Once that's done, if you choose to utilize Therap's billing system, what you just saw Kelly go through a few minutes ago, as we've said, that's available to you, but certainly optional if you want to do it. But if you choose to do it, you are then going to get handed to Kelly, who you just saw go through this. She is going to work with you to get in there to customize your service codes and payers. We're going to have all the service codes already in the system, but we're going to work with you to see which payers that your agency specifically work with and make sure that it's a reflection of exactly where you need to be able to bill. Then we're going to go through the setup of the claims templates and that whole process so that you have what you need to go forward. Our expectation is that the majority of you guys are going to fall into this category. So this is kind of the planned approach for the overwhelming majority of you guys to get things set up, and that's what our team is designed to do. Having said that, we also know that there are probably several of you out there that intend to utilize a third-party vendor, someone that you're already working with to do EVV. And for you guys, the focus is obviously going to be a little bit different because we've got to be able to set up that vendor that you're already working with to be able to send data to our aggregator. So we're not going to be working in a Therapy EVV account. The first thing that we're going to do there is, first of all, basically get you the paperwork that's needed in terms of signing off on the vendor attestation that they can do the things that need to be done in order to meet certification and to be able to successfully share information. So we're going to extend that to you. We're also going to send our business associate agreements and end user legal agreements for information sharing over to you guys and your vendors. You're going to receive that through DocuSign from our contract specialist, who likes to come in from Beverly. She will be sending that to you guys to get all of the sign off on all of those things. Once we have that and have all of those agreements in place, then it will come time for the technical piece, where we're going to give you one of our technical specialists who's going to work with you to get the specs set up for sharing information with the aggregator, the API. Going to work with you to get all of the credentials and testing access that you need to set that up, and then will be available to you as you go through and develop and test to meet the needs of our aggregator to be able to send information from your system. As I said, it is kind of an ongoing certification process, so we obviously want to get all of this stuff started as quickly as we can, so we have plenty of time to work through that and make sure that the information can get shared. So those are the 2 primary processes that we're going to use for onboarding through the system. And so I think I just saw a question that I think I may want to answer really quickly. What was that last question? Would an AMR be considered a third-party vendor? And the answer there is possibly. Some electronic records have certified EVV systems as part of their platform. Some do not. So obviously we can't speak to exactly who you're working with. That would be a conversation to be had with your vendor if that's your intent as to what to do. But again, whoever you identify, will be happy to work with them to go through that certification process to make sure that they can do what they need to do. Just want to make sure that that question is answered. It doesn't mean that all EMRs are EVV, but some of them certainly do have that available. But once we go through that onboarding, either the EVV platform, the Therapy EVV platform, I should say first, that we're going to go through in that series of calls, or if you're using the third-party vendor and going through that certification process, where we all come back together is through the use of the aggregator, because everybody's sending the data to that. So we're going to then be working with you to set up your access to that. That will be a little more limited than the EVV access. And what I mean by that, our EVV platform, essentially all of your support staff and caregivers, everybody needs to be able to access that, to be able to check in and check out, do their shifts. You've got your scheduling administrators, that sort of thing. The aggregator access is typically not nearly as widespread. It's a little more confined to particular administrators whose job it is to make sure that your EVV data is getting over there to the aggregator and meeting that requirement. But we will work with you to identify who that particular person or persons needs to be and get them the access that they need to get into the aggregator. I've mentioned a lot over the course of the call this morning, the various training resources that we're going to be providing. As I said, you'll have the one-on-one time with our actual staff to work with you and ongoing instructional webinars and things like that. We've got, as I said earlier, a full library of async materials, but we also now have a site that's easily linked directly off the therapservices.net site, full of resources specifically for the state of Kentucky. You'll see as I click on that, this site is now live where you can see these resources. You've got a lot of videos in here. You've got a lot of other support resources. Depending on your particular role and what you need to do, you're going to get a series of links to a bunch of different user guides that are in here. So if it's as simple as creating a new user, I can quickly do that. I can link it right off of the page, that sort of thing. So we've got a lot of information here. We've already got in here information about your billing service codes, which ones are required for home health. This is going to be a site that is constantly in flux. We're constantly going to be adding new resources as we move through this process. As we go through more and more of these conversations with you guys, the stuff that you guys are putting in the chat helps us know where your questions are, and we're going to be compiling that information and reflecting it on here. So we're going to be adding in an FAQ section of frequently asked questions so that you guys will have this as an ongoing resource to answer those kinds of things. So I encourage you guys to check back on this site on a routine basis, because we're going to try to keep having new stuff that's in there for you. Get back here. And then kind of the last piece of the training, but quite frankly, probably the most important, because this is the training that we're going to be providing to your direct support folks. These are the caregivers. These are the folks providing the service on the ground with individuals. And so this kind of training is going to be provided in a variety of ways too, from live webinars that we're going to be doing. We're going to be covering some of this in some of the town halls as we get a little farther down the line. You know, we don't want to train everybody on checking in and checking out until the accounts are ready for them to be able to go in there and do that and practice it. So we're going to kind of stagger it to where it's more appropriate, where folks have that access available to them. But we'll focus on the things here that caregivers need to be able to do, primarily the checking in and the checking out, and use of EVV, how to log into the system, and how to access training resources themselves should they have questions. We obviously want to make sure that the resources are available, not only to your administrators, but that your support staff also know how to get in there and access that information as needed to be able to do exactly what it is that they need to do. Now, last piece here, I know I've mentioned this before, but again, want to make sure that folks are aware that we are going to continue to be doing these town halls throughout the fall, throughout the entire timeline of the project, so that you guys will have a constant revolving resource to check in on what's going on. We're going to be recording all of these as we have are recording today, and then making these town halls available to you to go back and watch should you need to, or to share with other staff members that have not been able to attend. As I said earlier, these first 2 or 3 of them will probably have a reasonably set agenda based on what we think you guys need to know to get things rolling. But as we move further along, we are going to adjust all of these to accommodate the needs of the users. What we see as the major areas of concern or the frequently asked questions that are popping up, those are going to be the things that we use to populate the agendas going forward. So please share information in the chats and with your support folks. Do not be bashful. We want to know what's going on and what's the most priority to you guys, so that we can tailor the resources we're providing you to that end. And so with that, that brings us to the end of our agenda for today in terms of all the information we wanted to cover, but we intentionally built a little time in here at the end to see if there are additional questions that you folks may have. And we've got not only myself, but a team of therapy resources here, as well as representatives from CHFS that are certainly happy to begin answering your questions. So let me look over here. I can see we've had a few come in. It looks like most of them have received a response. Here, yes, If my team can kind of help me scroll through here, I don't see any that it looks like everything.
I was just going to say some great questions coming in there, and please do scroll back through and read them. And as Jason said earlier, anybody asking a question is doing everybody a favor. One of the things that I did want to comment on, because I've seen it kind of popping up throughout a number of the conversations going on there, is Therap's model around billing in the EVV is, basically we try and keep them to a degree separate, so that if you want to do your own EVV and your own billing, you can do that. You will then collect your EVV data. You'll submit your claims to the payer, whether that's the MMIS or the MCOs, basically as you always have done. But you will still need to submit that EVV data to the aggregator, because whoever your payer is going to check that there's substantiating EVV data in the aggregator before they approve that claim. Okay, the Therap's aggregator is not going to generate the claim. So if you choose to do your own EVV and your own claims, then that's great. Again, if you do want to do your EVV and your claiming in Therap in our EVV system, that's fine too. But you're not forced to do that. The only thing that you absolutely have to do is make sure that you're getting EVV data to the aggregator, again, either from your third-party EHR EVV system or by using Therap's EVV system.
Any other questions from folks? Look through here. Okay, here's the question. When will interface specifications be available? We're going to provide that information to you. As I said, once you guys get the job form and we get the agreements in place, that's part of what we do. We're going to provide that information to you with the technical support to get that rolling. So that's when that will happen. Yes, Melissa, we feel we have absolutely adequate resources. You guys have seen how many folks that we have on the call today, and we have a lot more that are going to be helping with onboarding all of these folks with dedicated time. We absolutely expect to be providing great one-on-one support to each and every one of you guys. Any other questions? On the CHFS side, April or Kelly, anything else that you guys want to touch on for our attendees today?
Hey, Jason, it's Pam. I will,
Hey.
sorry. I snuck in a little bit late. So the one thing I just do want to tell people is, because there have been a lot of good questions going back and forth in the chat, but that we also will make those available in kind of our first frequently asked question. I think it'll be our first frequently asked questions document. Now I kind of question myself as I say that, but we will be putting that out there. So don't worry if you've missed something in the chat. We will be gathering all of those, and we'll be putting that out there so that individuals have access to that, as well as any individual that did not get to join us for the live session today and is watching the recording, that they will have access to all of that as well.
Good deal. Thank you, Pam. And let's see, anything else before we close up shop? Is there any claims impact date that I'm assuming that means, is that the point at which claims may be denied based on submission? Is that what you guys are referring to there?
I would assume that, Jason.
That's my assumption. Okay, gotcha. Thank you. And I don't know, Pam, do you want to take that question? I know we're going to be doing a soft launch, but you can speak more to that.
Okay, so initially we will be collecting the data. So it on the MMIS side, we call it a pay-in list. So we will be capturing any visits that would have denied because there wasn't a corresponding visit when the MMIS got the claim, and be providing technical assistance to the providers. I believe that will go no longer than 90 days, but we'll give more feedback after we go live and see how January is going. But initially, we will be looking at and noting the claims that would have denied because there wasn't a corresponding visit, but we will not be denying them. We will be providing technical assistance and feedback to the agency so that there's opportunities to maybe fix something or know what's going on. And we know this is, I mean, this is humans that are doing this process. So, and I can tell you through testing in various ways, people are going to forget to clock in. People are going to forget to clock out. I've done test cases, and I even had a specific, I needed to clock out at this specific time, and it would be, that was on a Friday, and I would be going somewhere with my husband on a Saturday, and I'm like, oh my gosh, I forgot to end my EVV visit. So, I mean, there's humans that are doing this, so there's never going to be perfection from the beginning. So or ever. So we understand that. And so, we will be here along with, Therap has a very strong team, as Jason said, to be there to provide technical assistance, but you'll also have access to your DMS team as well. We'll work very well with Therap as a team, and coordinate and collaborate with each other to make sure that the providers are supported.
Absolutely. Yes. Thank you, Pam. And anyone else? And let's see, we've got a couple more minutes, so give you guys a chance. All right. Well, not seeing anything else come in. I guess we can go ahead and close up a minute too early. But before we do that, I just want to again say thank you for all of you guys that participated in, and also thank you very much to the folks from the state of Kentucky and helping to organize this and really running the webinar and all of that good stuff. I think it's been a really good 90 minutes here where I think we provided a lot of information. You guys have asked a ton of great questions, which have been good. As Pam said, we're going to be kind of consolidating that information and creating an FAQ sheet that we'll make sure to share with you guys so you can refer back to some of the answers that maybe you didn't see as they came in. But again, we very much appreciate the time you guys have spent with us. And again, one last plug for what you guys are going to see. All of you are going to get that initial jot form from us first thing Monday morning, and that's really what's going to initiate the whole process. So certainly keep an eye out from that. We will get that information to you, get the ball rolling, and we look forward to working with all of you in the very near future. Thank you, guys. And anything else, Pam, before we close it up?
I don't think so. Just it's going to be a very busy next 90 days, and I just encourage everybody communicate. Don't get frustrated. Reach out to us so that we can work through any questions that you have. That's what we're here for. And I believe we have a short runway, but I believe we're still set up for a very successful implementation of 1/1. So everybody have a great weekend.
Absolutely. Thank you, guys.
Thanks, everyone.